Probably one of the most frequent questions that I get from both my patients and urologists that are out there in the community are, what can we do for patients who have kidney cancer that's limited to the kidneys? And what I'll start by saying is that in about 1/3 of cases, we see that kidney cancer at the time of diagnosis has already moved out of the kidneys to the lungs and to the bones and to other sites. But for those fortunate patients where the kidney cancer is really limited to the kidneys, the standard of care in 2013 at this moment is simply to resect the kidney, and in some cases just to resect the area of the kidney that's involved with the tumor. This is the difference between what's called a complete or radical nephrectomy and a partial nephrectomy, nephrectomy referring to removal of a portion of the kidney. Now, what can we do beyond removal of the affected portion of the kidney or the entire kidney in patients who have no evidence of kidney cancer spread to other parts of their body? The standard of care at this moment is simply to observe those patients, to perform routine CT scans to make sure that the kidney cancer hasn't recurred or spread to other parts at certain points in time beyond that initial surgical intervention. What's really important for you to know, though, is that there are a number of really neat and innovative clinical trials that are out there to take therapies that we know work once kidney cancer is spread. These are so-called targeted therapies, and to apply them for patients who have localized disease. One such trial that we're participating in at City of Hope is called the Everest trial. And in this particular clinical trial, patients are randomized to either receive a drug, an active compound called Definitor, or a placebo for a duration of 1 year. Now, this is an example of one of many clinical trials that are out there for patients who have disease that has been completely resected with no evidence of cancer spread. And I would definitely encourage that you ask your urologist or medical oncologist about the potential for participating in such studies.